So we're going to work on iliac crests first of all. So trying to go through this in a slightly more logical process. So again, we need to expose, so nearly happen me just pulling up your t-shirt and lowering down your shorts slightly so I can get to the very top of your pelvis here, the top of your hips.
Yeah.
So we just raise up and then pull slightly down because we need to get to the very front, this portion here, and then the actual ilium and the iliac crest is in here. Now to find the iliac crest, we're going to come into this part here, which is nice soft. We've got ribs, we've got the pelvis, we're going to come into that softer part in the middle there, and we should feel that it's nice and soft and squidgy. If we then come down, we then come to bone. At that point there, we've met the bone, that is the pelvis, and that is therefore the iliac crests. Okay? So we can come from the iliac crests towards the rear, don't come right underneath, don't start trying to give them a hug, just come from this slightly posterior lateral portion, and we'll deal with the rest of it when we turn him over later. And then from here, you can either do it bilaterally if you're able to make an appropriate comparison, or keep one hand still and feel one side iliac crest, and work your way around slowly and methodically. If we keep coming round, and round, round, and then eventually you come to the front point where you've then got this nice sticking out portion at the front. So that is iliac crest round to the ASIS, the anterior superior iliac spine. We can do the same thing on this side, following round, 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 until we come to it. And do that way. Don't just, I've seen it 1,000 times where people go ASIS, that's there. If you make that assumption and don't go through the process, for one, you'll lose marks, and two, you are assuming that they're in the same position. They can have a tilted pelvis or a twisted pelvis, and it could shock you when you go, oh, you've only got one. So go through the process to find both of them, and then you're actually feeling them and also looking to see if in this position they seem equal, as well as having looked at it in your observation when they're in standing. Okay? Okay, next up is the pubis symphysis. So Neil, I need your help on this part. What I'd like you to do is with your hand, from your belly button, I'd like you to walk your way down, sort of through past your navel, and until you come to a bony part, which is essentially at the very front of your pelvis. That part there is known as your pubic bone. So you could work your way down over the top of your shorts till you come to what feels like a hard bone part of your pelvis. Once they reach that part, you need to feel over the top of their hands. Make it clear that that is what you're going to do and why you need to do it. So Neil, if you just keep your fingers there, I need to now feel on top of your hands to ensure whether you feel any pain experienced at all. There are the two bones converge together like this, so I'm going to essentially feel that side and that side, and then in between the two is a joint. I'll then also feel in that joint for any pain. Okay? Are you happy with me proceeding?
Yeah.
Okay, so then on top here, what I can then do is I can feel over to one side where we've got the right hand side tubercle, over to left side towards the left tubercle, and then in between the two where there is then the joint line. Okay, obviously asking for pain throughout. Okay, so if you just, we're going to next move on to where the ASIS and the pubis symphysis join together, which is then our inguinal line. So again, if you could just walk your hand down just to that same point for me, please, and just keep your hand there. I'm then just going to feel again to find this point at the very front of your pelvis, just on this one side. Okay, so there is our ASIS, and the inguinal ligament, and therefore the line, is from the ASIS to the symphysis pubis. Now we can feel, especially if we come at least halfway down that line between those two, we are feeling along the ligament and feeling for any issues or pains that they may have. Once we get halfway, that should be the joint line. To also check that, what we need to do is find the greater trochanter, find the very top of it, and see if that's bisecting at the same point. Okay? So Neil, to find the next part, what I need to do is roll your shorts up And I shall work up the outside of your leg to this bony point at the very top of your thigh.
Yeah.
Happy with me doing that?
No problem.
Roll the shorts up. So we're going to work up the outside, so I'm just working up the outside here until we come to the bony landmark there. So it's nice and clear on Neil. On some people you may find it difficult palpating with your fingers, in which case use the palm of your hand and get a little bit firmer in terms of being able to push this way. So if you push there, and you can see the force that I'm putting in, then you'll feel the bone a lot clearer. That then gives you an indication that that is where it is. So then I can double check again with my fingers, go, yeah, definitely on it. Find the very top, as well as the very bottom, and the front, and the back. So you're going top, bottom, front, back. If we then recheck the top, that is that line there. Again, if you could just run your fingers down onto your pubic bone, and we have our PSIS. Draw a straight line from here and across, and that's almost exactly halfway. Come to that same point, so in theory that is our joint line for the acetabulo-femoral joint. And now I want to check whether I'm in that location and feel it while we move the joint around. So if we raise the leg up, come onto the top of the knee, just gives us a little bit more in terms of control without having to kind of grip hold of their leg this way. So on top of the knee, and then I can just move their hip around in small circles. I can feel there I'm definitely at the joint line. Okay? Okay, so the last two is the PSIS and the ischial tuberosity. To find that, they need to be on their front, and we can also finish off the last part of the iliac crest to find the PSIS. If you could turn over onto your front, please. So again, Neil, I need to just raise your t-shirt up so I can get to the lower part of your back, into the top of your pelvis. And I may need to roll your shorts down slightly just to get to that. Are you happy with that?
That's fine.
Here, the shorts are pretty much in the right position already. So again, same thing. Come into this soft part, come down. There we have the ilium. So I'm going to do it, I'll do it bilaterally this time, so both at the same time. It's a skill to learn to do that, but it can make your assessment process slightly quicker, but take your time with learning that. Try one side at a time for now. I shall work my way around now. So now I'm following the iliac crests all the way around. Just bear in mind, like I say, it's almost like the arch on the top of Wembley Stadium, where it arcs round and down. So you've almost got two Wembley Stadiums, one on the left, one on the right. Follow it all the way around and down till you come to some very nice, clear, prominent parts that stick out at the back there, and that's your PSIS. Again, looking for how level they are. Don't assume that those both going to be in the same position. And in general, in some people, that's also where the little dimples lie. Okay, so then we can feel right side and left side PSIS. Okay, last one is the ischial tuberosity. Now, Neil, for the next part I need to feel is essentially in your buttock crease, just here, where we've got, essentially we'll go from buttock to thigh. So along that crease line there is where I need to feel the last bone. Okay, it's in the middle of your thigh here.
Yeah.
So to do that, I need to roll your shorts up. Are you happy with me doing that?
Yeah.
We roll our shorts right up here. We roll and tuck. Okay, so now we have the gluteal crease line here. We go mid-thigh onto the gluteal crease line, and then we push down until we can feel for the bone there. And it's always in the same position there, and that is our ischial tuberosity. Okay, tuberosity itself is quite big. It's almost like someone like that underneath there, sticking out. So we do need to feel all of it. So we can come medial, we can come lateral, and then just slightly rolling downwards inferiorly and superiorly all the way around. Obviously hamstrings originate here, so important one to feel.